Chapter 19, we're going to talk a little bit about the nutritional aspects of gingivitis and periodontal disease. How does our nutrition affect those two diseases, which is really important because that's what we treat. Gingivitis, as you know, is inflammation and swelling. We're going to see changes in the contour and consistency of the tissue. There's presence of plaque biofilm, calculus, or possibly both. There's bleeding on probing with gingivitis, but radiographically, there's no evidence of attachment loss or bone loss. Periodontal disease, on the other hand, is a chronic, ongoing inflammatory infectious disease that results due to a loss of the connective tissue, so the attachment to the teeth, as well as alveolar bone, and periodontal disease can be seen radiographically. So the targets of Healthy People 2020 for these diseases was to reduce moderate and severe periodontitis from 13 to 11% in patients ages 45 to 74, to reduce the prevalence of tooth loss due to periodontitis. The primary factor of periodontal disease is the plaque biofilm accumulation around teeth and gingiva. So plaque is the root cause. We have to have those bad bacteria in order for perio disease to happen. Nutrition can alter that development, our ability to resist the disease, and the repair of the periodontium. So the physical effects of food on perio health can be, one component is food composition. The imbalance of nutrients can disrupt the tissue integrity and the immune response to the bacteria. So normal growth and development of perio and oral mucosa depend on vitamin A, gives epithelial tissue integrity. It also helps with the salivary gland formation and components. Vitamin C, like I said, C for collagen and connective tissue, which is our attachment to the tooth. And then the vitamin B complex is important for epithelial tissues as well as connective tissues. Calcification of the bone and cementum requires amino acids, which are the building blocks of protein, calcium, phosphorus, and D. Those all three work hand in hand, as well as magnesium. And then for the maintenance and integrity of the oral tissues, vitamins A, C, and D, protein and carbohydrates are important, as well as calcium, iron, zinc, and folic acid. Food consistency. Chewing firm, coarse, fibrous foods can stimulate saliva flow, and an increase in saliva enhances oral clearance of food. It reduces the food retention that we'll see with carbohydrates and things of that nature. Plaque biofilm is not physically removed by eating firm foods. The patients do still need to brush regularly to remove that biofilm at least twice a day, but it does help in the stimulation of the saliva flow. So some nutritional considerations for perio patients. We would like increased nutrients and energy are required by the perio patients experiencing stress, tissue breakdown, and or infection. So remember, energy is calories. We want to make sure that they're getting enough calories, and we want those to be nutrient-dense calories so that their bodies can repair. We want a good medical and social history so that we can indicate whether a patient is at risk for these nutrient deficiencies. We would do some dietary counseling of perio patients to enhance that repair and wound healing, to improve their resistance to infection so that they will respond well to our treatment. And hopefully that would reduce the number and severity of complications they may have. So causes for gingivitis. Local as well as systemic factors such as being immunocompromised. That can be a factor for gingivitis. Medications can affect that. Hormonal changes, we see it a lot during pregnancy, puberty, and even menopause. Vitamin C deficiencies are going to be huge because of the collagen production, wound healing, all of that is dependent on collagen repair. So a lack of nutrients is not a cause of gingival inflammation, but may be a predisposing factor because it can disrupt tissue repair. We want to encourage those vitamin C rich foods and a well-balanced diet, and try to help patients make more nutrient-dense food choices. And this is just a typical image of what gingivitis looks like, which you guys are very aware. You see it every day in clinic. Now for chronic periodontitis, the initiation and progression of periodontitis does not occur, remember, without the presence of plaque biofilm. That is the cause. There are lots of factors that affect perio and can make it worse as well, but plaque biofilm is the cause. Excess glucose and sucrose results in an increased rate of bacterial growth in these patients. So certain types of food, enhanced food retention, and severity of gingival inflammation can all be affected by their diet. Systemic nutritional status will determine the immunocompetence of the periodontium. So maintaining that healthy diet and avoiding those retentive fermentable carbohydrates is so important. And this is a chronic periodontitis patient. You can see here from the image, we've got a loss of alveolar bone. We've got lots of buildup and plaque and redness and inflammation, and maybe even some mobility in some of those teeth if you were able to test them. So for periosurgery, preoperative care, we want to conduct that preliminary assessment of the patient for adequate nutrient reserves. We want to make sure that we have the nutrition that we need for this patient to have the best response possible to any periotherapy or periosurgery. Elective surgery may need to be postponed for a week or two if their nutritional status isn't where it should be, and that is to give them an opportunity to build that nutritional status up. Medically compromised patients should be referred to a registered dietitian before any type of surgery is performed. Patients should be given a tailored meal plan with nutrient-dense foods and beverages to choose and consume during their recovery. Sometimes recommending liquid nutritional supplement is good because their mouths are sore and it's painful to eat. So these Boost and Ensure and I think Sustacal is another one. Those that contain enough protein and vitamins and minerals are a good thing to help them get their nutritional status where it should be. For post-op, due to the amount of blood loss that they could encounter and the increased breakdown of tissue and tissue regeneration, host defenses after periosurgery need to be up. So we're going to require them to have adequate nutrient intake. They absolutely must have that protein and those vitamins where they need to be in order for them to heal properly. The dietary intake can be influenced by anorexia. If they just don't have the desire to eat, things don't taste good. Maybe they're nauseous. Maybe they have difficulty swallowing or oral discomfort. So we want to also make sure that we discourage smoking and the use of straws because that will break loose any clot. And we want those clots to stay in place so that they can heal. So with post-op, many times we'll start with a full liquid diet, and this is when a patient is unable to chew or has a mouth pain. So those Boost and the Ensure and things like that. Then we would go to a mechanically altered diet, which is soft foods, applesauce, mashed potatoes, maybe even mac and cheese, soft foods that are used when our chewing is compromised. And then as we can, we want that patient to return to a normal diet as their pain subsides and as they're able to tolerate it. Necrotizing periodontal disease is an acute periodontal disease. It's prevalent in young adults. So we've talked about NUG, which is necrotizing ulcerative gingivitis. If that is allowed to progress, it can actually become NUP, which is the necrotizing ulcerative periodontitis. And this can occur if it's allowed to progress without treatment, or possibly this is a patient that's had NUG multiple times. And for perio disease, it exhibits many of the same symptoms. We are going to see that red, shiny marginal, labial, and lingual gingiva that's going to bleed when it's probed. You're going to see those cratered interdental papillae. On top of those, there's like a grayish sloughing of the tissue many times. They have very foul breath. They may report a metallic taste, sometimes even a fever, pain, and then we're going to see those nutrient deficiencies. Usually a patient develops NUG due to stresses in their body, in their life, poor diet. All of those things can be a factor. And this is what that looks like. You can kind of see that grayish sloughing on top of those cratered papillae. So for a patient with NUG or NUP, while their ulcerations are present, we're going to encourage bland, soothing foods such as gelatin or pudding. Definitely want to avoid spicy and acidic foods. Liquid diet may be needed initially with that advancement that we talked about for periosurgery, where we go to a mechanically soft diet followed by a regular diet depending on the patient's tolerance and their comfort level. Cooler temperature foods tend to be more soothing, and then we may need to refer them to a registered dietitian or nutritionist to be evaluated. Recurrence of NUG is possible, so preventative guidelines should be emphasized. Now's the time with that patient to really educate, help them understand why they've developed this condition and what they can do in the future to prevent it.